Hello, and welcome to the new series, Random Facts of Wikipedia, where we briefly summarize randomly selected Wikipedia articles via the Random Article button from a layman's perspective. Disclaimer, information is not guaranteed to be correct. So, today's article is on a rather unfamiliar topic, congenital hearing loss. So, hearing loss, which is present at the time of birth. Um, so as we can see, this can include hereditary hearing loss or hearing loss due to other factors at the time of birth, such as complications. Um, Genetic factors are thought to cause more than 50% of all congenital hearing loss. So seems like the largest factor here is transmission through the parents. So looks like that's broken down into a few categories here. Autosomal dominant hearing loss, meaning that one parent carries the dominant gene for hearing loss, and recessive. So one parent will have a recessive gene. Um, so it looks like in autosomal dominant, one or both of the parents will actually have hearing loss themselves, likely. And in recessive, both will normally have normal hearing. And just happen to pass on a gene that was not displayed in themselves. If we take a quick look, we can see in a linked Wikipedia article, autosomal dominant versus recessive, taking a look at this kind of diagram that we have here. So in dominant, we can see that if we have just one parent which is affected, so in this case, it would be the father would have normal hearing, the mother would likely have impaired hearing, and we can see that there's about a 50% chance of passing on this dominant trait onwards to the children. And this is in the case where there's just one parent who is a dominant carrier. In the case where we have two parents who are dominant carriers, we can see that the rate would then go up to 75%. And then if we look at autosomal recessive, we can see here that in this case, we would have, for example, one parent that has one dominant gene and one recessive one, and the other would have the same. So in this case, we can see that both dominant genes have been passed to the completely unaffected child. For both of the carrier children who are not affected, we can see that they have been passed the dominant gene, one dominant gene and one recessive gene. And then for the case of the affected child, we see it's only 25% chance where they would be passed on both recessive genes and would likely be affected. The next category that we have here is X-linked hearing loss, which is kind of interesting. So in this case, it seems that the mother has the recessive trait, and this can be passed down to male and female children. So, taking a quick look at the linked article on Wikipedia, we can see here in sex linkage, there's a few different cases where we have affected fathers and mothers, um, and two cases for the mother, basically, one where the mother is affected and one where the mother has a recessive allele, basically. So if we take a quicker look at a couple of these diagrams here, we can see in the case that we have an unaffected father and a carrier mother. So we can see that the Y chromosome, obviously, to the son will have to come from the father. So in both of those cases, we have a 50-50 chance of getting a recessive allele, which the mother can pass on. So in 50% chance, the son will be unaffected. And for the other 50% chance, we can see that the son is affected, because that's the only X chromosome that the son has. And for the daughter's case, we can see, again, it's a 50-50 chance, but the daughter in this case would receive a dominant X allele from the unaffected father, meaning that she would be a carrier but would not be affected, as compared to a case where we would have um, an affected mother, in which case her X chromosome is going to be dominant, and the father's will be recessive. So a daughter, in this case, if they receive the X chromosome, the daughter would be affected as well. So for congenital hearing, it seems that we are looking at this particular case with a recessive allele. So the chance of getting affected is greater, specifically for the son. And then it appears that there are other causes, infections, illnesses, and other complications that can arise at the time of birth. And this would probably account for, half to less than half of congenital cases. It appears, according to this sentence that up here. For interventions, there are some different paths that some child who is affected with congenital hearing loss can take. So, of course, the earlier the better it appears, for the child's development, and for being able to improve on their hearing. So they should begin receiving intervention as an infant before they even reach the age of 6 months. And there is some information about, the U.S. and some laws around it, as well as some programs available in public school. But it seems that surgery is an option for some of these different malformations or structural issues that could be causing hearing loss for a child. Otherwise, a very standard one, which we might be familiar with for congenital hearing loss and even other hearing loss that comes later in life, would be a hearing aid, which amplifies sound, and this would work for most likely those who are affected but still have some level of hearing left. However, if the hearing has degraded to such a degree, this might not be adequate, and there might have to be other surgeries like cochlear implants, or other assisted devices. And of course, the main method of communication that an affected child or even an adult later would most likely be able to benefit from in the US especially would be American Sign Language.